Welcome to This Explainer. Have you ever wondered what actually happens in that crazy, beautiful flurry of medical activity the exact moment a baby is born? It's a literal choreographed routine. Today, we're going to break down the ultimate welcome check-in, a newborn's first 24 hours.
Here is what we're covering today. First, the crucial first minutes. 2, measuring weight and vitals. 3, the head-to-toe physical. 4, checking physical maturity. And 5, testing nerves and muscles. Let's get right into it.
Section 1. The crucial first minutes and decoding the APGAR score.
So what exactly is the APGAR score? Well, it's essentially a baby's very first test in life. They get this assessment precisely at 1 minute and again at 5 minutes after birth. The whole goal here is just to quickly catch any breathing problems or other immediate health hiccups. Now, if a baby has a somewhat difficult time during delivery and needs a little extra help, or maybe they score less than a 7, doctors will actually keep checking that score at 5-minute intervals for up to 20 minutes.
To figure out that score, doctors are looking at 5 key signs. We've got heart rate, breathing effort, muscle tone, reflex, and color. For every single one of these categories, the baby gets a score of 0, 1, or 2. Add all those up, and you hit a maximum total of 10 points.
Now, you might be thinking you absolutely want a perfect 10, right? Actually, a 10 is pretty rare. Most completely healthy babies score an 8 or a 9. And that's just because newborns naturally have blue hands and feet right after delivery. Their circulation is just a bit immature. So an 8 or 9, that is a totally fantastic, normal score.
Moving right along to Section 2, measuring weight and vitals and establishing the baseline.
Once the immediate thrill of delivery settles down, it's time for the scale. And here's a wild stat that constantly catches new parents off guard. Newborns frequently lose up to 8 to 10% of their birth weight in just the first few days of life. I mean, picture a 7-pound baby dropping over half a pound almost immediately.
So is this sudden early weight loss dangerous? It definitely sounds a little alarming when you just hear the raw numbers out of context.
Well, you can take a deep breath because the answer is no. Yes, in those first few days, they lose up to 10% of their birth weight, but within 2 weeks, they naturally gain it all right back. It's just a standard biological process. Now, the one exception here is premature or sick babies. They might need some extra calories to help them catch up. But for a healthy, full-term baby, this initial dip is totally expected.
While they're checking weight, the medical team is constantly monitoring the baby's vitals. And the numbers are kind of crazy compared to us adults. A normal newborn pulse, that is racing at 120 to 160 beats per minute. Their breathing is super fast too, clocking in at 40 to 60 breaths per minute. Just to put that into perspective, you and I are usually resting somewhere between 60 and 100 heartbeats a minute. They also make sure the baby's temperature is staying stable in a normal room environment, essentially checking that their tiny internal thermostat is fully online.
All right, part 3, the head-to-toe physical, checking every system.
This is exactly what it sounds like, a comprehensive top-to-bottom health sweep. Providers are looking at general appearance, skin texture, and posture. They're gently feeling the head shape, paying special attention to those delicate soft spots on the skull, the fontanelles. They listen to the heart and lungs and carefully check the abdomen and genitals. Basically, they're ensuring every single physical system is open, formed, and doing its job.
Next up, Section 4, checking physical maturity, also known as the Dupowitz or Ballard exam.
So why do we even need a gestational exam? Well, sometimes the exact dates of a pregnancy are, a bit fuzzy. To find out the baby's true biological age, doctors use this specific test, and it happens in 2 distinct parts. First, the physical maturity check happens within the first 2 hours. Then, the movement and reflexes part happens a bit later, anytime within the first 24 hours.
During those crucial first 2 hours, doctors are hunting for some really fascinating physical clues of maturity. For example, immature skin might literally feel sticky, whereas mature skin might actually be peeling a bit. They check for lanugo, which is that soft, downy hair you often see on preemies. They even look at how deep the creases are on the soles of the baby's feet and feel the thickness of breast tissue and the stiffness of their ear cartilage.
Every single observation gets a point value. Low scores, like a 1 or 2, mean the baby is physically very immature. On the flip side, a 4 or 5 means they are very mature, or even post-mature. And this distinction is an absolute game changer, because a tiny baby isn't always premature. They might just be physically small, which means they need a totally different care plan than a true preemie.
Finally, Section 5, testing nerves and muscles, the final neurological checks.
Sometime in that first day, doctors run through 6 wonderfully named neurological tests. They observe general posture. They do the square window, which is gently flexing the hands toward the wrist. They test arm recoil to see how the arms spring back into place. They measure the popliteal angle by extending the knees, perform the scarf sign by drawing the elbow across the baby's chest, and finally, do a heel-to-ear test. I know, it sounds like a tiny baby yoga class, but they are totally harmless, gentle stretches that give a highly accurate read on neuromuscular maturity.
And this is where it all comes together. By adding the physical score to the nerves and muscle score, the healthcare provider gets a really close estimate of the baby's true gestational age. It completely takes the guesswork out of the equation, giving the medical team the exact data they need to map out the absolute best possible care for that specific newborn.
So if that wraps up our explainer today, but I want to leave you with a thought. Beyond all these numbers, the scores, and these vital early hours, what subtle signs of life and development will we learn to read in our babies next? The precision of newborn medicine is just phenomenal, giving us peace of mind right at the starting line. But honestly, it's really just day one of a massive, fascinating journey. Thanks so much for joining me for this explainer, and I hope it leaves you curious to learn even more.